It's 2 a.m., you have a throbbing headache, and you're rummaging through your medicine cabinet. You grab whatever looks familiar, pop a pill, and hope for the best. Sound familiar? If you've ever taken medicine without really understanding what it could do to your body long term, you're not alone. Millions of people self-medicate every single day, often with dangerous consequences they never see coming. I'm your host, and welcome to HealthDecoded, the show that breaks down complex medical facts into simple, actionable insights that could literally save your life. Today, we're exposing 5 common medicines that seem harmless but can wreak havoc on your body when self-prescribed. And before we dive in, I want you to think about this: have you ever taken an antibiotic without a prescription? Maybe borrowed one from a friend or finished an old bottle from last year's infection? If you answered yes, well, stick around. What I'm about to tell you might shock you. These aren't rare, exotic drugs we're talking about. These are medicines sitting in medicine cabinets across the world right now. Medicines people take every day thinking they're helping themselves, when they might actually be causing irreversible damage. So let's jump right in with the first culprit. Number 1, antibiotics. Now, I know what you're thinking, but antibiotics cure infections. And you're right, when used correctly. Here's the problem: most people pop antibiotics the moment they feel a sore throat or get a runny nose. But here's a fact that might surprise you: about 80% of sore throats and nearly all common colds are caused by viruses, not bacteria. And antibiotics? They do absolutely nothing against viruses. Nothing. But the damage doesn't stop there. Every time you take an antibiotic unnecessarily, you're essentially training the bacteria in your body to become stronger, smarter, and more resistant. It's like giving your enemies the blueprint to defeat your defenses. And let's talk about your gut health for a moment. Your intestines contain trillions of beneficial bacteria that help digest food, produce vitamins, and protect you from harmful invaders. Unnecessary antibiotics can wipe out these good bacteria, leaving you vulnerable to infections, digestive problems, and even mental health issues. Here's a question that should keep you up at night: if you keep misusing antibiotics today, will they still work when you desperately need them 5 or 10 years from now? Because antibiotic resistance is real, and it's killing people. The World Health Organization calls antibiotic resistance one of the top global public health threats. We're talking about a future where simple infections could become deadly again, just like they were before antibiotics were discovered. Moving on to number 2, steroids. And no, I'm not just talking about the muscle-building kind. I'm talking about corticosteroids, powerful anti-inflammatory drugs that people often grab for skin rashes, joint pain, or breathing problems. These medications are incredibly effective when prescribed correctly, but they're also incredibly dangerous when misused. And here's the scary part: they often make you feel amazing at first. Your pain disappears, your energy skyrockets, you feel like a new person. But your body is paying a hidden price. Long-term steroid misuse can trigger weight gain, mood swings, depression, high blood pressure, diabetes, and even bone loss. Your adrenal glands, the organs that naturally produce hormones, can actually shut down, leaving you dependent on external steroids just to function normally. I want you to imagine waking up one day and discovering that your body has forgotten how to produce its own essential hormones. That's not science fiction, that's a real consequence of steroid misuse. And women, listen carefully: steroid misuse can disrupt your menstrual cycle and affect your ability to have children. Men, it can impact your testosterone levels and sexual function. Is temporary relief really worth these permanent consequences? Number 3, sleep medications. Now, I get it. We live in a stressful world, and sometimes sleep feels impossible. You've probably seen those over-the-counter sleep aids at the pharmacy, or maybe someone offered you a prescription sleeping pill, promising you the best night's sleep of your life. But here's what they don't tell you on the packaging: your brain adapts to these medications faster than you think. What starts as an occasional helper can quickly become a nightly necessity. Let me paint a picture for you. You take a sleeping pill tonight, and you sleep great. Tomorrow night, you try to sleep naturally, but your brain has already started to expect that chemical assistance. So you take another pill. And another. Before you know it, you're not just taking pills to sleep better, you're taking them because you literally cannot sleep without them. But the problems don't end with dependency. These medications can cause memory problems, next-day drowsiness, and in older adults, they significantly increase the risk of falls and fractures. Some studies have even linked long-term use to an increased risk of dementia. Here's a question: when was the last time you tried to sleep without any aids? If you can't remember, or if the thought makes you anxious, you might already be more dependent than you realize. Number 4. Painkillers. From over-the-counter ibuprofen to prescription opioids, pain medications are probably the most commonly self-prescribed drugs in the world. Now, I'm not saying pain medication is bad. When used correctly, it's literally life-changing. But here's where people get into trouble: they start treating pain medications like candy. Oh, my headache isn't going away, let me take 2 more. My back still hurts, maybe I need a stronger dose. This worked for my friend's similar pain, so it should work for me. Sound familiar? Here's the reality: regular use of NSAIDs like ibuprofen can cause stomach ulcers, kidney damage, and increase your risk of heart attack and stroke. And prescription painkillers? They're designed to be highly addictive. That's not an exaggeration. Opioid addiction has become a global epidemic, and it often starts with legitimate pain that people try to self-manage. Every year, thousands of people die from painkiller overdoses. Many of them started exactly where you might be right now, with a bottle of pills and the belief that they knew better than a doctor about what their body needed. Ask yourself, how many times have you doubled a dose because the recommended amount wasn't working fast enough? Each time you do that, you're rolling the dice with your life. And finally, number 5, hormonal medications. Birth control pills, testosterone supplements, hormone replacement therapy. These medications don't just treat symptoms, they fundamentally alter how your body works. Your hormonal system is incredibly complex. It's like a perfectly tuned orchestra where every instrument needs to play in harmony. When you introduce external hormones without proper medical supervision, you're essentially letting a random person conduct that orchestra. For women, this might mean irregular periods, increased risk of blood clots, or fertility problems. For men taking testosterone supplements, it could mean your body stops producing its own testosterone naturally, leading to permanent dependency. And here's something most people don't realize: hormonal medications can affect your liver, your cardiovascular system, and even your mental health. We're talking about mood swings, depression, and changes in personality that can strain relationships and impact your quality of life. Think about this: your hormones control everything from your energy levels to your ability to handle stress, from your sleep patterns to your sex drive. Do you really want to mess with that system based on advice from social media or a friend's experience? So here we are. 5 common medicines that millions of people self-prescribe every day, often with consequences they never see coming. Now, I'm not trying to scare you. I'm trying to empower you. Knowledge is power, and understanding what you put into your body is the most important step you can take to protect your health. Your body is not a chemistry experiment. It's not a place to test theories you found online or copy what worked for someone else. Your body is unique, with its own history, its own needs, and its own way of responding to medications. So here's what I want you to do. Tonight, when you get home, take a look at your medicine cabinet. Really look at it. How many of those medications did you buy without consulting a doctor? How many are expired? How many are you taking based on advice from Dr. Google or a well-meaning friend? It's time to have an honest conversation with a real healthcare professional. Not because you're sick, but because you're smart enough to want to stay healthy. Remember, seeking professional medical advice isn't a sign of weakness, it's a sign of wisdom. Your future self will thank you for the informed decisions you make today. That's all for this episode of Health Decoded. If this information opened your eyes, even just a little bit, please share it with someone you care about. And don't forget to subscribe for more science-based health insights that could change your life. Until next time, stay curious, stay informed, and most importantly, stay healthy.